Good morning and happy Saturday. We are so glad that you guys are all joining us this morning. If you're still in your jammies, no judgment. That's actually the recommended dress code for this session. The only thing we need from you today are your smiles and curiosity. So I know I was already introduced, but yes, my name is Kerry. I'm doing this presentation with Shauna. For just a little background about myself, I've been nursing for about 15 years now. 13 of those years have been with cancer care in Winnipeg, working directly with patients, and the last 3 years working as a clinical resource nurse. A part of my role now is to help nurses who help you when unusual situations come up. We spend a lot of time thinking outside the box. As we all know, healthcare isn't a one-size-fits-all model. Shauna has been in oncology for over 26 years, so between us, we have about 4 decades of experience, not to age us, of course. So over the years, we have seen firsthand how overwhelming the amount of information can be for patients, from diagnosis to treatments, appointments, and follow-up care. Our experience has really helped shape what we're talking about today. Our goal is to share some practical strategies and communication tips we have seen make a real difference in helping patients feel informed, supported, and empowered, and to know the important questions every patient should be asking. So grab your coffee, settle in, and thank you again for spending your Saturday with us. We are really looking forward to a day of insight, connection, and maybe just enough caffeine to keep us all inspired. So before we jump in, or I say Shauna will join us, but before we jump into the meat and potatoes of our topics today, we wanted to take a second for a land acknowledgement. We'd like to begin by acknowledging that we are gathered on Treaty 1 territory, the traditional lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people, and the homeland of the Métis Nation. We recognize the enduring presence and deep traditional knowledge of the Indigenous peoples on this land, and we honor their ongoing contributions to the health and well-being of our communities. As we come together today to learn, share, and strengthen care for patients and families, we do so with respect and gratitude to those who have cared for this land and for one another for generations. So to start off with, I'm going to talk a little bit about information overload, and then I'm going to pass it along to Shauna to follow that up with essential questions we feel are important for every cancer patient to be considering. We also created 2 handy cheat sheets to cover both topics, so please feel free to just listen and take the information in. The handouts we created are available under the Resource tab at the bottom of the session menu bar. So I'd like everyone to think about this question. How many of you have felt overwhelmed during an appointment you or your family member had with a doctor, whether that was at cancer care, with another specialist, or even your family doctor? I know I personally have been in that spot before with a family member who had some health issues. I tried to keep track of everything by repeating it back in my head, and I can tell you all I could remember at the end of the appointment was that the office had nice wallpaper. So this topic, information overload, why does it even matter, and why is it a topic today for discussion? Really, it matters because at the heart of it, it's about you. You, the patient, you being informed, engaged, and empowered to take part in decisions about your care. When you feel better equipped with knowledge instead of overburdened with information, you are better able to engage and participate in your cancer journey instead of feeling like you're just being swept along for the ride. Think of this example. You are prescribed a new medication and you want to know all about its side effects and what to expect, so you Google it, as we all do. You get about 1,000 hits on the medication, and each one you look at is a little bit different than the next. Then you dive a little bit further and you look at the personal reviews of the medication. So instead of 1 or 2 reputable sources about this medication and side effects, you now have a whole bunch of conflicting opinions about why this medication is either good or bad, enough to make your head spin. By the time you go to fill this new medication, you're either scared silly about all the side effects, or you might have even decided that you don't want to take it without talking to your healthcare provider. We see this kind of information overload in healthcare often. If you know better where the overload can happen, though, we can try and look at ways to manage it a little bit better. So where does this overload happen? When we look at this from a perspective of a patient diagnosed with cancer, the overload can show up in many ways and at different times, but there's a few key points or times that we see. So right at the moment of diagnosis, when everything is new and overwhelming, your doctor is going to throw out words and terms that you've never even heard before. And honestly, for a lot of patients, once you hear that word cancer, everything else is a blur. All that information, you haven't retained anything. Overload happens when weighing your treatment options. It's often a flood of information and decisions that need to be made quickly, like what treatment you'll be getting. You need IV access. What kind of IV access do you prefer? And where would you like your treatment? Add in multiple appointments, and unfortunately, they may not all be in the same spot. New medications with different doses and schedules that all have different side effects with all of the follow-up care that comes afterwards, and it can be a lot. It's basically a full-time job on top of being a patient, and that's on top of all the other responsibilities you have in your life. It's no wonder patients and families often tell us they feel like they're juggling too many balls at once. Understanding where the overload happens, though, can help us figure out how to manage it just a little bit better. So now that we've identified a few points where the overload tends to hit, I want us to take a closer look at what the overload feels like for patients and families and the impact it can have on decision-making, confidence, and even remembering what was said during your appointment. When we're dealing with all of this information, it's easy to struggle with remembering details, small or big. Like when your next appointment is. Did you pick up that refill? Did your friend say she could drive you to your next appointment or not? Because you can't remember what she said on the phone last time you talked. Making decisions, even small ones, can suddenly feel huge and overwhelming. With this, stress and anxiety naturally increase. Some patients feel completely lost in this shuffle, like they're just trying to keep up rather than actively participate in their care. And this is only a small part of your lives. There's all the other stuff that's going on. Your kids, your house, your job, maybe your parents who still rely on your help. Seeing how these factors impact you is essential because it really highlights the importance of staying organized and how what we're talking about next can make a difference. So let's get to the practical. How can we actually manage the information that we get? We've got a handful of simple strategies that can genuinely make a difference. I hope everyone holds on to them because they're steps we can all take. So the first one that I feel is really important, if you can, bring a support person to your appointments with you. That's someone with an extra set of ears who can listen, take notes, remember details you might forget. They may also think of questions you didn't even realize you wanted answered, especially since some of those appointments can be so overwhelming. If your support person can't be there in person, you can always ask to have them included over speakerphone so that they can still participate in your appointment. Another option is to ask your team if they would be agreeable to have the appointment recorded. For this, it is really important though that you have that discussion with your team first. We also suggest keeping a dedicated notebook or binder or just a simple folder for so that all your information is in one place and easily accessible. You will get some printed information from your team when you go on treatment. There will be appointments that come in the mail, blood work requisitions, amongst other things that you're going to receive. When you have a dedicated place for everything in your home, it will help you ensure that you're staying on top of things. Next, and I am just as guilty of having this happen to me, we have all walked out of the doctor's office, gotten in our car or gotten home and went, shoot, I really wanted to ask the doctor that question. It has happened to all of us. When you have those questions pop up before your appointment, write them down. I can tell you from a clinic nurse perspective, I always appreciate when people come in with those lists of questions. It helps make sure we don't miss anything important that you might need clarification on, and that you really understand what your care plan is. It doesn't need to be a formal list. Jot it down on a sticky note, scrap of paper, put it in the notes on your phone. Just make sure that you're bringing it up or bringing it with you when you come to your appointment so that we're talking about it. Also, don't forget, you can also call your clinic nurse if you have any questions. If they don't know the answer, they will get it for you. I'd like to say one little reminder about this though. Our clinic nurses and teams, they have very structured days. So sometimes they're in clinic caring for patients, sometimes they're triaging calls. If you can't reach them when you call, please leave a message. That's really important, and that's the best way to ensure that you get someone to call you back with an answer. So leave that message, leave it detailed. That helps your nurse figure out what resources they need so that when they call you back, they have an answer to whatever it is you need. And last, break decisions into manageable steps so that you can tackle them all at once instead of feeling overwhelmed. Think of it like how you would manage all the small things in your house. If all of those little things, taking out the dishes, doing your laundry, doing your dishes, taking out your garbage, doing your laundry, vacuuming, doing the bathroom, when all of those things start to pile up, it can feel really overwhelming when you go to tackle them all at once. If you decide that today you're just going to do your dishes, tomorrow, if you have the energy, you're going to do the laundry and maybe the bathroom, or you'll do it the next day, it can make it feel less overwhelming and more like something you're able to accomplish. So really, breaking things into small steps and decisions if you're feeling overwhelmed can be beneficial. When we do that as well, it might allow us to actually see what we need to prioritize, what we really should be doing today versus maybe what can wait until tomorrow. Using these strategies can help bring some order to everything that's going on, even if just in a small way. So once you've got a handle on those basics, the next step is organizing, kind of like cleaning out your closet, but with your medical information. So here are some suggestions we feel will help you do that effectively. Cancer Care has an app for patients called the MyCare Nuna app. The MyCare Nuna app lets you see all of your appointments in Cancer Care. It also allows you to communicate with your team, see blood work results, receive messages, announcements, and educational resources from your team. It even allows you to keep a journal of how you're feeling and your symptoms. It's a very handy resource for all of our patients, and we recommend it to everyone. If you aren't tech savvy, which I totally get because I'm not either, we also have someone who can help set that app up with you if you're having trouble. Let your team know if that's the case and they can connect you. It's also something that a family member could use on your behalf with your permission, of course. For those of you that don't want the app, I get that. We also have lots of those on our phone, and it's not for everyone. In those instances, we recommend keeping a calendar, either paper or electronic, just to help you keep on top of all those multiple appointments. If you've created that binder or folder that we talked about, group your contents by topic in your folder. Put your treatment details in one section, put all of your appointments, your requisitions in another, your contact information in another, just to keep things organized. You will, when you start treatment, get information sheets from your clinic team. Try keeping those together and going through them at home when you have a quiet moment so you can absorb everything without feeling pressured. And while you're reading them, write down any questions that come to you so that you can answer them, you can ask them at your next appointment. Or if you have a question that can't wait, once again, call your clinic nurse. That's your resource. He or she can get you the answer to whatever questions you might have. And highlight for yourself what's urgent versus what can wait. What must you do now or know now versus what you could push off to tomorrow. Keeping your information in order this way can help you feel more on top of things and confident, even if it's just ensuring that you're not missing any appointments. So we've talked about managing information and organizing it, but none of that works if we're not communicating effectively with our teams. Clear communication can make a huge difference in how confident we feel about our care. Here are some simple yet very effective tips to help with communication. First, and so important, if you don't understand, please ask your team to explain again. It is our job as the healthcare team to ensure you understand your plan and no question is too small. If you still don't understand, ask again. Sometimes we need things repeated a few times or explained in a different way so that we can understand it. Repeat back what you've heard. This is called the teach back method, and it helps make sure that you understood everything correctly. It also allows for clarification if there was any difference between what was said and what you understood it to mean. Don't be afraid to say that's too much for right now. Everyone's human, and sometimes we need information in smaller pieces. Ask, what do I need to know today? So that you can focus on what's important. Ask for written information if needed. Notes, handouts, and printouts can be lifesavers when your brain is just too full and can't process anything else. Think of it as your personal life hack. If you don't understand, ask. If it's too much, pause, and if it's written, you can come back to it later. So I've covered a lot for today in a very short time frame, but before we move on to the next part and I pass it over to Shauna, I wanted to take a final minute just to go over a few key takeaways we feel are important. Information overload is normal and common in cancer care. There is a lot going on. You're not alone in feeling this way. You don't need to absorb everything at once. Take it step by step. Your brain will thank you. Use the tools, people, and resources available to manage it gradually. Bring that support, organize your information, and make sure that you are asking questions along the way. And finally, clarity helps you focus on what truly matters to your health. Knowing what's most important to you will help you make informed, confident decisions. Those takeaways give you the foundation to manage information with confidence. In the next part of our session this morning, we're going to focus on knowing which questions to ask, because asking the right question is just as valuable as the right answer. I'm going to pass it over to Shauna now, who's going to join us on stage, who will guide you through the key questions every cancer patient should be considering. Thank you.
Good morning. Like Kerry said, my name is Shauna, and I'm also really happy to be here with you today. I will start by telling you a few things about myself. I've been an oncology nurse for around 26 years, and I have loved it. I'm currently a patient representative at Cancer Care, so I get to be a liaison between patients and their families and their care teams when people have concerns or questions as they navigate the healthcare system within cancer care. Another thing about me, in the summer, I love camping and kayaking. And in the winter, I like to plan to kayak and camp. I have some adult kids, and I have two very adorable granddaughters. So sometimes my life is really calm because we're empty nesters now. And sometimes my life is chaotic because the adult children and their babies like to come over and eat my food. And I love it. But today we're here talking about cancer. There are a few things that I know for sure about people who have cancer. The first is that nobody's bucket list includes having cancer. The second is that it's really important to have the very best information you can in order to make the very best decisions that you can. One of the hard parts with having a cancer diagnosis is that there is so much information that you don't know. You don't even know what you don't know, and that's pretty normal for any of us. But the stakes feel really high when the things that we don't know are related to cancer diagnosis. We all live our lives understanding that we don't know everything, but when we're talking about cancer, it feels really risky to be missing out on knowledge that's important. It makes sense that as we start to learn the things that we don't know, we gain more knowledge by asking questions and having experiences. But sometimes those questions that we ask leave us wondering, am I asking the right questions? Am I asking the best questions? Am I missing something? What then happens is that we gather information, we learn more, we have more experiences, and then we enter a new part of our cancer journey where something changes and we're right back there again, wondering, am I asking the right questions now? In my years of working with people who have cancer and their families, I've had many patients have conversations with me when they tell me things that they would like to improve, or questions that they would have liked to ask, things that they would have liked to have known. So I want to share with you a few thoughts that these patients have taught me about getting the best information that they can, and about a few thoughts about the questions that they have found most helpful. There are two categories of questions that I'm going to share a little bit about. The first one is, I'll call it, what are the questions to help or to ask your oncology team? It's pretty obvious why these questions can be helpful. This is what a lot of people want to know, and for very good reason. The second category I'm going to call what are the questions or reflections that you might find helpful to ask yourself. And these questions are more personal, but I'll explain their usefulness when we get to them. Let's talk for a few minutes about good questions to ask your oncology team. Why do these questions matter? Why does it matter what you ask your oncology team? Well, they matter because finding the right answers to your questions will help you make decisions that are right for you. They matter because your questions and concerns are important to your cancer care team. And they matter because we want you to have good and reliable information. I have a couple of thoughts about finding good questions. So when people say, what are the questions that I should ask? There's some different ways of going about thinking about that. Finding good questions isn't about copying a long list of everybody else's questions to bring to your oncologists, but it's actually about taking a look at questions that other patients have found helpful and maybe watching out for the ones that set off a bit of an aha moment for you. If you're the kind of person who wants to look at a long list of questions to kind of get your mind thinking and find the ones that seem really helpful for you, couple of thoughts. One, went ahead a bit too quickly. One is to go online. So we all Google, we do. It's kind of what we do. But we have to remember that when we Google and when we look online, there's good information and bad information, and it's not always easy to tell which is which. And I want you to have good information. So one of the places that I would suggest that you could take a look at is go to the Canadian Cancer Society website. It's really reliable information, and all of the information on there is through the lens of healthcare in the Canadian healthcare system. If you go on the Canadian Cancer Society website, and again, these things are all in the handouts that Kerry and I got ready for you, so you don't have to write this all down. If you go on the Canadian Cancer Society website, you type in the search bar questions to ask, and you will find a wealth of good and helpful questions that other people have asked that are specific to different points on the cancer journey. And yesterday when I checked on the Canadian Cancer Society website, there were 694 questions to go through. So don't just print those out and bring those all to your oncology team. We'll find the ones that are best for you. Some of the questions, though, that you might see there might trigger a thought or a question that you didn't, or that maybe you had but you didn't have the words for, or there might be a question that triggers something that you want to tuck away for the future. So going to the Canadian Cancer Society website is a good place to kind of get some ideas. And the other place that I'm going to suggest is the handout that Kerry and I gave. We included some questions that we think are really important for you to ask, and we included some kind of more nuanced questions that come out of my conversations with patients. And back to not what questions should I ask, but what kind of information is reliable. If you're looking for reliable information, I highly recommend the Cancer Care Manitoba website. It has really helpful information on it that's applicable to healthcare in Manitoba. And you can also go to the other provincial cancer websites like Cancer Care Ontario or BC Cancer. Those websites often have similar information, but some of them word things in a different way that might make a bit more sense to you. So my encouragement, if you're the kind of person that wants to look at a list of other people's questions to find something helpful, find the questions that are helpful to you and let the rest go. You don't have to have all of the questions. Not all of them will land with you, and that's okay. I'll share a few starter questions just to get you thinking so that you kind of have an idea of what I mean. So the starter questions depend a bit on where you're at in your cancer journey. They depend on what information you need to make the next decision. Maybe not every decision, but what's the next decision? And the questions that you're going to ask are going to depend on what is most important to you. Again, these questions are all in our handouts, so you don't need to take notes. I have a couple of questions that I'd love for you to ask your oncology team, and they're about processes at cancer care. When you have your first appointment or when you see a new cancer care team, please ask them, who do you have written down as my contact person in case they need to call on my behalf? And ask them, what's the phone number that you have written down for them? If you want more than one contact person listed on your chart, that's totally fair, but it's probably a good idea to designate one of your contacts to communicate back and forth with your oncology team. Another thing that is really helpful to ask your oncology team when you meet them is, who do I call if I have questions? You can always call somebody if you have questions that you think can't wait until your next regularly scheduled visit. But like Kerry said, they will give you a number. Make sure that you leave a voicemail. If somebody doesn't pick up the phone, it's not because they don't care, it's because they're really not sitting right there right then, but they want to hear from you. So when you leave a voicemail, leave your full name, leave the reason for your call, and leave the best number to call you back. Couple of other thoughts. When you're newly diagnosed, some questions that you might want to ask, kind of the typical ones: what's my diagnosis? What stage is it? Has it spread? But then you're going to want to say, can you spell it for me, please? Because having the correct information from the start is like having the best foundation to build everything else on. When you're deciding on a treatment plan, some questions that you might want to ask, and these are all on the handout: what are my treatment options? What do you recommend and why? And you might want to ask your team, how long do I have to make a decision? We often assume that decisions have to be made in the moment. But like Kerry said, when somebody hears the word cancer, often that's kind of the end of being able to absorb and make really good decisions. So ask them how long you have to make a decision, and they'll have a good answer for you. Just some other little questions during treatment. You might want to ask them, how will we know if my treatment is working? How often are we going to check? And some people like to ask their oncology team, is what's happening to me what you expected? To figure out what your oncologist is thinking about your progress or your side effects or symptoms. These questions are by no means an exhaustive list. They're just a few to get you started. But remember, there's no such thing as wrong questions. And there's no expectation that you won't ask your questions more than once. Just keep in mind that there's a lot of information to know in order to make an informed decision. We talk a lot about informed decisions, but there's always going to be things you don't know. So an informed decision doesn't mean that you have no more questions or that you have all the answers. That's my gentle reminder to you. We want you to be informed, and we want to know that you can ask questions anytime. I told you before that I also want to talk about a little category of questions that I encourage you to ask yourself or reflect on for yourself. And the goal of these questions is the same as the other questions. The goal is still to get the best information possible. But these are more personal questions. And the reason that I want to talk about this is a little bit that we know that every person who has cancer is unique. You are not the same as any other person who has cancer. There are similarities, but you bring yourself along on the journey. You come with your own unique experiences, your own values, your own worries, things like that. Reflecting on questions that feel personal can feel vulnerable, and that's okay. But the intent of reflecting on these things is it's another way to give yourself the best chance at making decisions that are right for you. I want to share about something called the patient dignity question. The patient dignity question was developed by Dr. Harvey Chochinov. Dr. Chochinov is a professor at the University of Manitoba, and he's also a senior scientist at the Cancer Care Manitoba Research Institute. Throughout his years of research and conversations with patients, Dr. Chochinov developed an evidence-based single question for healthcare providers like myself, like oncologists, to consider when they're talking to patients, either formally or informally. The question that Dr. Chochinov developed, it's called the patient dignity question, is, what do I need to know about you as a person to give you the best care possible? The intent is to reveal invisible factors that might not otherwise come up, because we need to take those into consideration when we develop your care. If we flip Dr. Chochinov's question so that it's helpful for you, it might say, what do I want you, as my oncology team, to know about me the patient as a person, to give me the best care possible. So the question to ask yourself is, what do I want my oncology team to know about who I am? Because that's going to impact the care and help me make good decisions. These questions are all in the handout as well. I'll share a couple so that you can kind of think about what this looks like. But again, these are personal. They're more for reflection. And so I want you to take a look at the handout that we gave. You might want to ask yourself, what are my values? We all live according to our values, and they influence the decisions we make every day. And these are helpful for your oncology team to know. Maybe an important value for you is family, or independence, or hope, or legacy. And that's going to impact how you make decisions. You might ask yourself, what are my worries and concerns, and what would be helpful for my team to know? When someone hears a cancer diagnosis, there are some really common worries. Am I going to get through this? Are they going to be able to cure me? How uncomfortable am I going to be? What will this mean for my finances? Those are just a few examples of some of the more personal questions. When you think about the question, what do I want my oncology team to know about me to give me the best care possible? So a couple things to remember. Good questions help us find good information. Good information helps us make good decisions. There will always be some unknowns, and that's okay. We have some time to answer some questions that you have. So if Kerry wants to come up. I think is Cheryl going to be asking questions? Or do you want us just to read them? Yeah, we can see them.
Ooh, how about I take this one? I've been to cancer care before, but I'm not sure where to find information about the MyCare Nuna app. And when, I'm sorry, I can't see. And when you say the MyCare, are you referring to Nuna?
We can't quite see them.
Can't see the bottom of the question. Oh,
so
okay.
The first question.
So the first question, you can find the information, and there's a QR code on the Cancer Care Manitoba website under Patient and Family Resources, and then it will actually say MyCare Nuna app as a line to go into. In all of our waiting areas, we have posters for the MyCare Nuna app. In all of our exam rooms, we have a poster on the wall as well. All of those have the QR code that you can scan to get into the what you need to do for the program. When you say MyCare app, are you referring to Nuna? There is a MyCare app on the App Store. Should we be using this instead? Yes. You have to have the MyCare app in order to be connected with your care team. You have to download the app first.
And then let your care team know that you want access to Nuna, and they will send you a link. Is that correct?
It gets done automatically when you scan the QR code.
Yeah. And then the link helps you sign in.
Yes. Ooh, your husband's Nuna app does not work. Who can we contact for help? You know what, actually we can put that information. There is a number that you can call. I'm sure that we can put it at the bottom of the link. But in the meantime, you can always call your healthcare team. So call your nurse, call your clerk, either of them. We all have the number for our IT gentleman who helps us out with that, and we can connect you. So if you can't do it, call your team.
Yep. I could do this one. Do you have suggestions for patients on a watch and wait? So people who are watching and waiting, the first thing that comes to my mind is you'll want to have clear answers from your oncology team. What are we watching for? And at what point do we need to change the plan? How often will we be looking at this to find out if there's something new? The hard part is once you've heard the word cancer about yourself or a hematological disorder, those things don't leave your mind. So watch and wait can often feel for people like it's, why aren't we doing anything? there's sometimes really good reason to not do anything in the moment. Oncologists and hematologists we practice at Cancer Care through evidence-based research. That's what our oncology team uses to make decisions. So when you are told we're going to watch and wait, it's really just saying we want to keep a close eye on you for any red flags so that we know if and when there's a time to make a treatment plan change. But my biggest question is, have some good clarity on what are we watching for, how long are we waiting, and how often are we going to keep following up.
The next question, it's a big question. I don't think that there's a one simple answer for this, but what resources are available for seniors and very elderly patients who have been diagnosed with cancer with no family support and do not have the capacity nor the mental acuity to understand what's happening and how to navigate the healthcare system? We do have resources. There is lots. So we have our psychosocial department that we can connect you with, a set of counselors. That's probably the easiest way to describe it, that you can sit down and chat with. They can help with a lot of things. They can help navigate systems. They can help put you in contact with other areas, districts. Even if there's stuff going on with your finances, they really are able to help navigate some of those things outside of your care. If you're elderly and having issues with your care itself, there are things that your clinic nurse or your clinic team can do. They can put you in touch with home care that can set up some services if you're struggling at home and managing. If you're living in an apartment and you're not able to, for instance, you just can't look after it, you can't clean anymore the way you did, mobility is affected, they can try and arrange for someone to come in once a week or once every 2 weeks to help you, maybe help you with laundry. So there are lots of resources out there to help with people who are struggling. I would say, and we will always say this, if you don't know, if you're struggling when you're going in for your appointments, please have those discussions with your teams when you're going in. Sometimes maybe we're not asking the right question that's teasing it out what's going on at home. If you're having issues, if you're struggling and you let us know, we can connect you. We will find a way to connect you with what you need to help you as best we can so that you are properly cared for. Shauna, maybe you can add a...
I agree with that. I read this question and I know that the healthcare system is not easy to navigate for those who are within the healthcare system who have a lot of experience like that. So there's nothing, there's no expectation that people know how to navigate a system that's kind of complicated. So yeah, we definitely want to help you. If you talk to your clinic nurse, give them a call. Let them know kind of the things you're struggling with. Sometimes people connect patients with the patient representative office as well, and we're another resource that can help make sure that we support you well. Every once in a while we do go to appointments with patients that feel like it would be helpful to have somebody there to take notes for them, make sure their questions are answered, things like that. Want to do this one? Do you want to read it?
Yes, I can read it. How do you respectfully make the oncology team I'm going to paraphrase that a little bit. How do we respectfully reach out to our oncology team to let them know that you feel rushed during meetings and that appointments, and this makes appointments feel overwhelmed?
That's a great question.
It is a very good question. Yeah. And I know that when you come for appointments, there actually can be times where perhaps you do feel rushed. Maybe the clinics are running behind. They spent a lot of time with one patient because sometimes we actually need to. There's a lot going on and it throws everything behind and they are rushing. When that's happening, let us know. If you're feeling overwhelmed or rushed, it's okay to say that. Can you take a second? I'm sorry, I feel like you're really rushing me and I have a few more questions to ask. If we don't know, sometimes that day is just speeding by so fast. If we don't know and you don't tell us, we can't do anything to change it or to make you feel like we are taking the time with you. So please, when that's happening, let us know. I think that's probably the most important thing.
I will need to miss the scan session. Will the recorded version be available for participants after they have been Zoomed? Yes, they absolutely will be available for everybody.
100%.
Yeah.
1 minute. Could we maybe just have our last slide up? I think we're done with questions for a session.
If not, that's okay.
Does that work? Ooh, which one?
That's okay. Maybe, maybe not.
Maybe not. Sorry, apologies.
If you have questions or thoughts about our session, please reach out to your oncology team. If you have specific questions for Kerry and myself, you can add questions after this, and I'll just ask the team to let us know if there's something you specifically want to talk to us about. But yeah, I look forward to listening to the rest of the day, and I think you're in for a real treat.
Perfect. We're going to leave it off with this.
Yep.
Nobody gets through this alone. It takes a village, your people, your questions, your courage, and all of your healthcare team standing beside you. We are here to walk beside you at every step. Cancer care is a part of your village. Thank you very much for joining us today.
Thank you.